I actually just got examined for Ehlers Danlos syndrome. I forgot to tell him about my hips actually, which I meant to do on my next appointment, but I didn't. But it doesn't really matter, I guess, because I'm still getting treated for it. But I just fell just short of the criteria. He basically said if I had family history, which I'm not sure how most people would have, because I feel like until recently not many people knew about it. And I don't know, my family definitely isn't the kind to have gone to the doctor with that sort of thing anyway. But what was the point? I have such an ADHD brain. Oh yeah, I'm getting these injections into my neck. I think it's like tetradecyl sulfate. I don't know. I should know because I am a scientist. I did chemistry and stuff, but not my area of expertise. But again, ADHD brain. What was I saying? Oh, no, still don't know. Oh yeah, I'm getting these injections, and I got them like in the back of my head and sort of like down just in my neck and my spine, to help with, I just have a constant headache and whole body pain that comes with Ehlers-Danlos. And not all hypermobility, but some people get pain and some people don't, which he did explain to me he doesn't know why. But yeah, so I'm getting those injections. I was given a few options. I could have done the glucose prolotherapy, PRP, or this new, like, not so studied one, tetradecyl sulfate. But the guy who's studying it in New Zealand reckons it is just as effective as PRP, which was going to cost me like $800 or $900 per session. But I think you're only supposed to have to do 1 or 2, whereas the glucose prolotherapy was like $200, but you get $80 back on Medicare. 220 or something, $240. But you're supposed to have like a lot more sessions of that, like 6 to 8 or something, for you to see like proper difference. But the tetradecyl sulfate was supposed to be similar to the PRP, but it was only 220 with like 80, or 240 with 80 back. So I was like, okay, well, I'll do that one. Like, I know it's not like long-term studied, but he reckons he's seen good results with patients, and the guy who studied it has done it for like 20 years and has seen really good results with his patients. So I was like, okay, I'm up for that. I don't have $800 to just dump on these appointments. I mean, like, if it was to solve my issues, I would absolutely pay that, because I mean, I've spent way more than that over the years trying to get healthy and feel good. But like, realistically, I don't have the money for that. So but yeah, I got it done the other day. It was just a little bit of bruising. I thought it was going to be really scary. Like, he got out a huge needle, but they don't really like go deep. They do it really superficial, and I could really barely feel it. It was a little pinch, and then you could feel like the fluid going in, but it wasn't painful at all, like at all. Like, to be honest, it was honestly kind of relaxing. So yeah, we'll see how that goes. I know I'm not supposed to see any results in the first few days, but honestly, I feel like it is a tiny bit better already, which is insane. That might just be placebo, who knows. But yeah, I'm taking the low-dose naltrexone, which I was already taking, but he said it should take at least 6 months on about 6 milligrams to see an effect. So, and I'm already seeing effects. Like, I usually react sort of like a mast cell reaction. I can get sort of like rashes and stuff, which aren't all the time. Like, I want to make clear, like, you don't have to be having rashes all the time for this to be an issue. Like, I sometimes get eczema, I sometimes get perioral dermatitis. I sometimes would get this rash like all around my body. What's it called? I feel like I forget, I'll insert it. But yeah, and my bladder reacts like I thought I had interstitial cystitis. Originally I thought I was just getting lots of UTIs, but and look, sometimes it was, but most of the time it was just me reacting, and I never knew for years, but reacting to like nightshades, tomatoes, MSG, alcohol, potatoes, things that are high in oxalates, I think. So like raspberries, citrus, like I couldn't have chocolate, coffee, like so many things that I would just react to, and it would feel like I had this UTI, and it was really bad bladder pain and awful stuff. But now I'm kind of just eating whatever I want, and I'm not having those bad reactions. I do need to clean up my diet because I know like I'm starting to feel it a little bit again. I think definitely I went on the carnivore diet, or like lion diet, for a while there, which was really good actually. Like I didn't realize I had like lots of gut issues, but after going back to eating normally, I'm like, oh, okay, I am reacting quite badly. Not quite badly, but like this stomach discomfort is not normal. Like you don't have to live with that. I just thought it was normal. I never really knew anything else until I did the lion diet or the carnivore, and was just like, wow, okay, I'm feeling pretty good. But yeah, so I'm on the LDN, and he's just started me on ketotifen, 1 milligram per night. He said we can step it up to 1 in the morning and 1 at night if I need to. But we're doing that, and as well as the injection. So I'm feeling quite hopeful. I'm feeling listened to, which is rare. So that's nice.